Hello. Welcome to the North Pole, land of the elves. I'm Dr. Elizabeth Ziner, Chief Medical Elf of our elf medical teams. We are thrilled to be here and so excited that you all came out to show your support for our teams. Our students are super excited and ready to show you their stuff. They've been training for this day and they want to take home that trophy right there back to their classrooms. As extra incentive, we sort of filled it up with candy. I don't think they need that incentive, but it's there for them. So we're again, thank you for being here. Please make sure to turn your cell phones off if you haven't already done that. Just a friendly reminder to do that. And a few thankful jingles to all the departments that made this event possible. A big jingles to the Media Services Department for getting you in on the action. The Marketing and Communications Department for helping us promote this event. Our CEC staff for organizing, putting the finishing touches, and providing you with the food. Our judges for their expertise and time. Our Blue Crew for helping set everything up. Our faculty who put their heart and souls in teaching our medical students every day. Thank you for that. And of course, our brave and courageous students who have the courage to get up here in front of you today. That takes a lot of bravery. So make sure that when they come out, give them a big round of applause. All right. So during the next hour, you'll watch the first-year team, known as the Newbies, battle the second-year team, known as the Arctic Puffins. Each team will have 10 minutes to complete their scenario, after which the judges will give them feedback. They will be judged on their teamwork and communication, and for the first time this year, their medical knowledge. We have put on your tables a couple of teamwork and communication forms so that you can help judge right along with them. Now, let's meet our judges. We have Dr. Robert Pepper, Associate Dean of Pre-Doctoral Clinical Education. He's had multiple roles throughout his career, including practicing clinician and residency program director. He knows how to get medical teams up and running. Dr. Earl Bundy. Dr. Earl Bundy has had several roles throughout his career here at WVSOM. He has 26 years of service in the military, in the Special Forces, Rangers, and as a master parachutist. Again, yes, he knows a thing or two about teamwork and communication. And last but not least, future student Dr. Aaron Bazinski. He's our second-year medical student, originally from Michigan, and current Student Government Association president. He taught technique and wrote music for drumline teams while in competitive drumlines throughout the Midwest. So he also knows a thing or two about teamwork and communication. Are we ready to bring out the first team? Yeah, let's make some noise for the first team.
You guys go first.
All right. So this is our first year team, the newbies. Woo! All right. So we have, and say, come on in, don't be shy. Good job. So give a little wave. Ryan Bailey, yes. Hello. Ravi Chudasama, Tao Wen, Patrick Quigley, and Michelle Russell. All right. Are you ready for your pre-brief? Yes. All right. This is going to take me a minute or two to get through it. I wrote a lot. I should have cut some of that down, but okay. You have your patient, Mr. Max McDashin, a 26-year-old male elf brought into the emergency room by the elf medic team from the Santa's annual reindeer games. According to his friends, Max seemed fine in the morning, his usual elf self. They went out to lunch where they ate shrimp and salad. Then they went to the reindeer games to cheer on Comet when all of a sudden, Max decided he wanted to join in all the reindeer games. His friends described him as delirious with excitement. They had never seen him in such an excited state. They tried to stop him, but he ran off and apparently stole Santa's snowmobile and took off on it. He jumped on the racetrack, lapped all the reindeer, crossing the finish line in first place. Everyone was astonished. When the local Elves at 8 news crew ran over to interview him, Max passed out and couldn't be woken up. The elf medic team was called, and they were told that one of the news crew caught Max while he was falling and gently laid him in the snow. His initial Glasgow Coma scale was 9. His eyes opened only to painful stimuli. He was making incomprehensible sounds, and he moved all extremities, localizing to pain. Vital signs: blood pressure was 72/44, heart rate 136, respiratory rate 22, pulse ox 96% on room air, and temperature 101.8. They did an AccuCheck, it was 110. On exam, his pupils were equal and reactive, his heart was regular, and he had good breath sounds bilaterally with equal chest rise and no tracheal deviation. No other obvious problems were identified. The EMT placed a large bore IV, which is in place, and began a bolus of 1 liter of normal saline. He was transported immediately to this ER, where you, the advanced ELF medic team, will evaluate and treat him as you see fit. Nurse Twinkle is your Confederate, meaning she will answer any questions you have about his physical exam and provide you any information that you ask of her. Everything you need will be in the crash cart there. If you'd like to do something that we don't have, you just need to verbalize that, and you are responsible for completing all procedures just like you would on a real patient. You will have 10 minutes to complete your scenario, and if you finish before time runs out, just let us know that you're done. If we have any technical glitches, please ask your Confederate the questions you have, and she'll provide you with the answers. Please verbalize everything you're doing. Do you have any questions?
No.
Okay. So we're going to assume that you've washed your hands and cleaned your stethoscopes, and then we have various size gloves right there on the crash cart there for you, and your time starts now. Please assign your roles and begin your scenario.
Okay, guys, so I will take team leader. Ryan, take circulation. Patrick, take airway. Tao, take PE. And then Robbie, you're going to scribe for us today. So, Patrick, let's start bagging him.
Okay.
Ryan, so
Can I get an intubation?
So the blood pressure is still a little low, so let's insert a large bore IV in his other arm. And then Tao, start taking clothes off. Okay. Exposure.
What fluids would you like me to give?
Let's give a 1 liter IV bolus of crystalloid solution, please.
I'll wait for you.
Okay, go ahead and back his the crystalloid in here. Is the crystalloid in here?
Yes. Okay. Just in here. Sorry, go ahead.
All right. With his hyperactive state, before he passed out, let's start thinking thyroid storm. But let's also not rule out sepsis. All right.
Mask.
I'll recheck his GCS. Sir, hello? Sir? Any?
He is
Response.
only responsive to painful stimuli.
Only responsive to painful stimuli. Okay. Can I have vitals, please?
Yes.
Okay.
Your vital signs currently are blood pressure 72/44, your pulse rate 136, respiratory rate 22, temp is 101.8, and your pulse ox is 96% on room air.
Okay. So we are doing good right now. So let's order some blood work. So let's get CBCs, coags, electrolytes, magnesium.
Lactate too.
Huh?
Lactate too.
Yes, lactate, and a thyroid panel as well.
Is the GCS still at 9?
Yes, GCS is still at 9. No change. Can we get vitals again?
Vitals are unchanged.
Vitals are unchanged? Okay.
There's no indication for intubation.
There's no indication for intubation right now, no.
There's a one here on the.
Your lab work has came in, doctor.
Okay, thank you. Okay.
What's the pulse
How's
here?
the pulses? Yeah.
Twinkle?
Yes.
What's
I'm
the pulse
sorry.
here? Is there any pulse here?
Yes.
Okay.
There are pulses bilaterally.
Okay.
Okay, lactic acid is high, and
Go ahead and intubate.
We can't. There's no indication for it.
T.
What's the
The
GCS?
GCS is above, it's above
Okay.
8. So we
All
can't.
right. and TSH, thyroxine, and thiodothyronine is also high. So we have an indication for sepsis as well as thyroid storm. So let's start administering methimazole, 30 milligrams of methimazole. And then in an hour, we're going to be administering potassium iodide, and we'll administer 10 drops of that. And then we'll also administer.
Can we get some images as well?
Okay.
Doctor, I have repeated your Glasgow Coma scale, and it is now a 7.
It is now a 7. Okay, so let's intubate Patrick.
I'll do the
Intubating?
airway, yeah.
Okay. Ryan, how's that IV coming?
I'm almost finished.
Okay, great.
There's no fold, right? No fold.
All right, and instead of administering normal saline in that new bore IV, let's administer 30 milliliters times 2.2.
Can I have the, is it deflated? All right, thank you.
Can
I
get
do an
a bag?
intubation.
Yes.
Oh, thank you.
Okay.
Can we get ventilation set up?
Lactate drink, right?
Just want me to switch. Am I allowed to do it this way?
You got the,
Yes.
inflate that.
All right. Ryan, here's your lactate ringers.
Oh, okay, thank you.
Thank you.
Thank you.
Okay. And then just bag it.
Could I get a new
you.
set of the spike?
Okay, intubation's in?
tube
Yes.
for the-
And just stabilize it.
Thank you.
You're welcome. And so how much lactate ringers would that be? 66. All right, so 66 milliliters of lactate ringers. And we administered methimazole, potassium
Intubated.
iodide,
Okay, intubated's in.
and then
Your primary.
esmolol is 0.05 milligrams per kilogram.
0.05.
Yes.
What's the patient's weight?
Patient's weight is 140.
Let's thank you.
Is there any swelling in the lower extremities?
No swelling noted.
Want to get a vent?
Huh?
Want to get a vent? No.
Oh, yes. Let's get a ventilator for this patient, please.
Absolutely.
Thank you.
Is there blood coming out of the wound, or is it pus, or what is it?
You note pus coming from your wound.
Okay.
Infection.
Alrighty. Go ahead. So let's go ahead and pack this.
Okay.
Can we have a packing kit?
There we are. Your
Surgical.
sponges are here.
Ryan, is IV administered?
No, I had to switch the spike
Okay.
bag.
All right.
Do we want to do a
And-
complete physical for the
Let's
palm,
do a
for the
total
rectum?
P. Let's do a lock roll here soon.
Yeah.
Yes. Log roll. Okay.
Can we have some tape, Twinkle?
Doctors, it does appear that your blood pressure is dropping. Your blood pressure is now 63/36.
Okay. What am I hearing right now?
You hear breath sounds?
Okay. Here.
Absent.
Absent. Okay. Let's do a E-fast exam.
It's on SM.
Ultrasound.
Tal, would you be
Okay.
able to take that since
Yep.
I'm still trying to get...
And can we get a central line in the patient, please?
Absolutely.
Okay, and we will administer Levofed.
What do I see on the sonogram here?
There
We will
is no one
do
sliding noted on the left.
Okay.
we'll do Levofed, an initial dosing of 12.
Can I get a chest tube kit, please?
12 micrograms per minute, and then we'll slow it down to 2 micrograms per minute.
I got it. Thank
There
you.
we are. Levofed is being hung, doctor.
All right, thank you. And also, let's administer some antibiotics for the sepsis. So let's administer vancomycin. We are going to do 1 gram of sevapine and 30 milligrams times 63.
Antibiotics, doctor.
Yes.
Okay, IV is placed. I am going to do an
Robbie,
e-fast
that's
exam.
1.9.
E-fast exam already done.
Oh, okay, thank you.
right, so to clarify, 1.9 grams of vancomycin plus 1 gram of sebapine for the sepsis. All right. Can I get updated vitals?
They are correct on the screen,
Correct on- Okay. And we have administered the Levophed.
Levophed is hanging, yes.
Okay, and is the crystalloid solution also hanging?
Yes.
Okay.
Down. Is my hairnet on?
Yeah,
Okay.
you're fine.
Antibiotic is hung, doctor.
All right, thank you.
Can you go ahead and open that glove? for me?
Ryan, can you continue a physical
Thoroughly?
examination just on the front of the body? We're looking for any other like puncture wounds besides the one that we see on his left leg.
Do I see any on the feet?
You do not see any puncture wounds on the feet.
Where are those scissors?
Scissors? Here,
Thank you,
doctor.
Hey, Patrick, can you go ahead and do a needle decompression for me on the left chest?
Needle decompression tray. What size glove will you need, doctor?
Large, please.
Go ahead and clean the site first.
Here you go, doctor.
Which lung is it?
Left.
Okay. So we've administered everything for thyroid storm
Everything, so you stay sterile.
and for the sepsis to treat it. Okay.
I should have got the gloves.
I'm sorry.
I do not see any other puncture wounds or any other injuries on
Okay.
the front of his body.
All right.
All right, big round of applause.
All right, well done.
There was a lot going on in that scenario. So you guys come right over here when you get your gowns off and everything. Good job, everybody. You can take your gloves off and everything. And just turn right around for us so we can see you, your pretty face. All right, very nice job, everybody. How do you think it went for you?
Pretty well for our first try, I think, but
Yeah. Yeah, it
initial
was a,
scenario.
How
It's
did
pretty
you
intense.
How did you decide who was going to do what role?
We had that pretty much planned out ahead of time, that Michelle would be team leader and that she would assign us what to do.
Good. And how do you feel your teamwork and communication was?
It was all right. It
yeah, I
could have
think
been a
it's-
little bit better with like the closed loop communication and saying like where we were and things.
I heard some really good examples of that and verifying and double checking what you were doing and making sure that you understood each other. So I think you did a pretty good job with that. If you had to do the scenario again, is there anything that you think you would have done differently?
I think something that took up a lot of time for me was that I had started one type of fluid and then I had to respike a different bag and go into another type of fluid before I was able to place the IV. So I think that took a little bit of time. So I think maybe trying to figure out which fluid that we would have given sooner than that.
Anything else?
Chest tube's taking a while.
It does take a minute. And I saw that you caught yourself about the needle decompression.
And I had, so since I was already gowned up, I would have to have Patrick do it.
Yep. Okay. So for the audience, you're supposed to do the needle decompression, which means putting a little needle in between the ribs to get some of that air out of the lungs before you went in for the chest tube. So you caught yourself, so that was good. I was really proud of you about that. And you guys did a nice little differential diagnosis, and you suspected that he had sepsis, which is an infection, right, from his abscess. And is there any other lab work that you think you would have ordered before you got the antibiotics going?
A blood culture.
Yes, and what else?
And a urine culture.
And the wound culture, right?
wound culture, yeah.
Yeah, very good. So, but I think you guys did an outstanding job. I'm thoroughly impressed with the antibiotics and the management, and you guys you got right on his care. So, good job with that. Let's hear from our judges. Yep. Very good.
Can you hear me? Okay. Well, I'm going to talk from a leadership standpoint. I think you did a good job coming in and establishing that you were the leader, but you weren't a bull. You didn't push people around. You got them to work with you very well. I like that. Coming from a military standpoint, that's a big deal. And you treated people well with respect. And people respond to that. Your division of duties was good. There was no panicking. I mean, you were moving around. You were a quick person. I've watched you. I've had you in some of the labs. You liked it. You're fiery. But you're not, but you don't panic. And that's a big deal. One thing I noted, I probably would have saved it for last, but even though this guy's not really aware, just every now and again, these folks can perceive what you're doing. And just a little bit of reassurance to them, even if you don't take the chance that they won't hear it, just assume they can hear something and use some encouraging tones every now and again. Let's see, good communication, good voice volume. You weren't screeching, there was no excess chatter from any of you, so you didn't interfere with one another. Let's see, yeah, you took advice from people when they offered it to you, and you also worked well with your nurse. So from a leadership standpoint, I would feel good around you in a tough situation.
Thank you.
Yeah, I'll speak from the just the communication point between you guys. So I really liked immediately you established roles right out the gate, and none of you really differed from that. So it's super important is that you remain in your assigned role until necessary, and that did happen when Tao, you needed to step in and do a procedure. When physical exam, you needed to switch in to do physical exam after you got the IV done. So you guys did really well in remaining in your roles and switching when necessary. And then definitely the closed loop communication stuff. You did very well with it. I know it's super new, and I mean even for me, it's a very new thing, but you did well with it. There was a couple instances where it would have been better to somebody repeat when it was done, like intubation done, somebody else say, okay, now a known intubation done. So then you can see it, but that way everyone knows that that thing is done. As far as utilizing resources, you did that very well too. You were versed in what drugs you needed to use, how much you needed to use, when you needed to do it, when you needed to check levels again. So I think you guys were definitely knew what you were doing as far as coming into this. You're prepared for sure. And then going into doing the EFAS exam as well as the needle decompression, you knew when to do the procedure, how to interpret the procedure or the results of your lab testing and your physical exam. So communication was great, and your overall ability to assess the patient was, I mean, you can definitely tell you guys put work in, so good job.
Yeah, I'm going to second what they said. I thought the communication was strong. From a technical aspect, there are perhaps a few things, and I think especially around the intubation. Initially, when we gave the vital signs, we said the O2 sat was 96%, the respiratory rate was 22, yet we wanted to bag that patient. It wasn't clear why we were bagging someone who obviously was oxygenating adequately. As the GCS dropped to 9, the vital signs were repeated, and again, oxygen was 96%. Then you asked about intubation, and then you said, no, do not intubate. But when she reported the GCS dropping to 7, we decided to intubate. No one rechecked vital signs at that point. Okay. So we should assume that the intubation was probably to protect the airway of a GCS of 7, and that's when he got the pneumothorax, right?
Yes.
So that would have been a good point to maybe check the vital signs again.
Okay.
And then same thing when we gave the Esmolol. We gave the Esmolol. No one really rechecked the vital signs. She ran over and said, now the blood pressure's dropped to 63/36. Mm-hmm. We progressed, but no one stopped the Esmolol, right? That would have been another good time to check in with each other and say, okay, what else can cause hypotension? Let's not make things worse. Again, this is high-level stuff for first years. I think you guys did awesome. But don't forget, always stop, pause, let's recheck where we are, and then go. Okay. So I think otherwise you guys did a really, really good job. Super complex case. I've never seen thyrotoxicosis in my life. It's pretty rare, and you picked it up by just saying that the elf was excitable. So I think that's really cool, and you guys did a really good job. Congratulations.
Thank you. Yep. All right. All right. So we're going to go into the task trainer room. I'll take your mics off and everything. All right, we're going to take a brief little intermission here so we can get our mannequin reset and our scenario reset. So if you need to take a restroom break or grab some more pizza, please do that now. Thanks so much. All right, are we ready for our second team, our second year team? Woo! All right, let's bring them in. Here they come, the Arctic Puffins. Woo! Right up here. Yep. Hello, everybody. All right, here we go. I'm going to introduce each of you and just give a quick little wave. I don't want to take your screen time. There we go. So we have Joseph Bolger, Garrett Parsons, Heather Reeves, and just so you guys know, those three participated last year, so we have some experienced students here. We'll see what they can do with that. Kelsey Steele, Michael Wilson, and Benjamin Woodward. All right, are you guys ready for your scenario?
Yes.
Okay, so you can start writing if you want to, or you don't have to, whatever you like. Okay, here we go. It's a little bit of a long one, so we're gonna get it rolling. All right, you have Mr. Max McDashin, a 26-year-old male elf. He was brought into the ER by the elf medic team from Santa's annual reindeer games. According to his friends, Max seemed fine in the morning, his usual elf self. They went out to lunch where they ate shrimp and salad. Then they went to the reindeer games to cheer on Comet, when all of a sudden, Max decided he wanted to join in on the reindeer games. His friends described him as delirious with excitement. They had never seen him in such an excited state. They tried to stop him, but apparently he ran off and stole Santa's snowmobile and took off on it. He jumped on the racetrack, lapped all the reindeer, crossing the finish line in first place. Everyone was astonished. When the local Elves at 8 news crew ran over to interview him, Max passed out and he couldn't be woken up. The elf medic team was called, and they were told that one of the news crew caught Max while he was falling and gently laid him in the snow. His initial Glasgow Coma scale was 9. His eyes opened only to painful stimuli. He was making incomprehensible sounds and moved all of his extremities, localizing to pain. Vitals were blood pressure 72/44, heart rate 136, respirations 22, pulse ox 96% on room air, and his temp was 101.8. They did an AccuCheck and it was 110. On exam, his pupils were equal and reactive, his heart was regular, and he had good breath sounds bilaterally with equal chest rise and no tracheal deviation. No other obvious problems were identified. The EMT placed a large bore IV and began a bolus of 1 liter of normal saline. He was transported immediately to this ER, where you, the advanced elf medic team, will evaluate and treat him as you see fit. Nurse Twinkle is your confederate, meaning she will answer any questions you have about his physical exam and provide you with any information that you ask of her. Everything you need is in the crash cart, and if you'd like to do something that we don't have, you just need to verbalize that. You are responsible for completing all procedures just as you would on a real patient. You will have 10 minutes for your scenario. If you finish before time runs out, just let us know that you're done. If we have any technical glitches, please ask your confederate the questions you have and she will provide you with the answers. Please verbalize everything you're doing. Questions? All right. We're going to assume that you've washed your hands and cleaned your stethoscopes before you came in, and we have gloves over there in various sizes for you. Your time starts now. Please assign your roles and let it go.
All right, I'll take lead. Heather, would you mind doing a quick head to toe on them?
Yep.
All right, remember glove up, everyone, please. Ben, Garrett, can I please get you on airway? Max, can you hear me right now?
Your patient is not responding.
Max, how you doing, bud?
He only responds to painful stimuli.
Okay. Can we get respirations at the moment?
Respirations are 22.
Okay. Ben, can we throw him on a nasal cannula, please?
Certainly.
How's my pupillary response?
At 4 liters, please.
Pupillary response?
His pupils respond to light.
How's lung sounds?
Lung sounds are clear to auscultation.
Any tracheal deviation?
Michael, can we
No
get a second
tracheal
IV going, please?
deviation
Like an
noted.
IV?
No JVD noted.
Can I get supplies for an IV?
Absolutely.
All right, with the second IV, if we could, Nurse Twinkle, get some labs whenever you have a chance. Let me know when you're ready. Nurse Twinkle.
Yes.
Can we get labs when we're starting that second IV, please?
Which labs would you
Can
like?
we get ABG, complete metabolic panel, CBC with differential?
Absolutely.
ABG, CBC.
CBC with differential.
And then you can go and start your trauma assessment.
Okay. Looks like you got an abscess. Thank you.
Where's the abscess located?
Do I have any?
Abscess is located on the left upper thigh.
Do I have any blood in my hands from going through the cranial bones?
You do not.
Any blood in the ears?
No blood in the ears.
Nose?
No.
Mouth?
No.
Okay.
Nurse Twinkle, could we also add some additional labs?
Yes.
Could we get some aspiration with cultures from that abscess, please? Could we get 2 peripheral blood cultures? Could we also get a Foley catheter with urinalysis, urine drug screen, and a urine culture as well, and oral culture, please?
Yes, absolutely.
How do my heart and lungs sound?
Heart and lungs are normal.
Any flail, chest, bruises, contusions, lacerations on the chest?
No flail chest noted.
Abdomen, is it rigid?
Non-rigid.
Colon or Gray Turner sign?
Negative.
Pelvic stability?
Normal.
What are our vitals at? I'm sorry.
Our current set of vital signs
O2 hooked up?
are blood pressure 72/44, pulse 136, respiratory rate 22, temp 101.8.
How are my femoral pulses?
They are present and equal bilaterally.
Yeah.
Okay.
If you could, please assess. Let's do a rush
Is this
exam.
an abscess or is
Assess
it,
IVC,
Your
please.
labs, doctor.
Thank you.
On the right.
Assess
right
IVC, please.
Do I notice any free fluid? Left or right quadrant?
No, this is just.
All right, on his left leg, he has what looks to be an abscess. Distal pulses in the lower extremities.
Normal, equal bilaterally.
How about distal pulses in the knees?
Normal, equal
Michael's IV
bilaterally.
in?
Thank you.
14 gauge in the right antecubital normal saline hung.
We have a high WBC count, so we're going to treat for sepsis with this. And let me see if I have the other labs here. Do we have a TSH free T4 at all?
TSH 3T4. I'll check with the lab on that.
All right, thank you. So if we can also get lactate level, I don't believe I see that in any of the current labs we have here, please.
Do we have a current GCS scale?
The current GCS is 7.
All right. Ben, since he's at 7, can we prepare to intubate, please?
Yes.
And Garrett, whenever you're done with the rush, would you mind assisting with that, please?
Here, doctor.
Or Michael,
What can I do?
could you assess with or assist with the intubation, please, since he's doing the rush? All right. We have a lactate level of 3.2. If we can get a repeat on the lactate just to confirm, that's above 2, please, just to confirm with sepsis criteria. Do we have the second IV in, Michael?
Second IV's in.
All right, so we'll give a 2-liter bolus of normal saline, please. Let's get the patient going. Do we have the T? Sorry. Yeah, so we have low TSH, we have high
Can I get that back?
T4.
Absolutely.
So I think we're dealing with sepsis as well as thyroid storm. So thyroid storm, as soon as we can get the pressure up a little bit, I'd like to get the patient started on esmolol beta blocker.
How much?
They're still intubating. Esmolol, let's start with 0.5 micrograms per kilogram.
Would you like that hung now, doctor?
Yes, please. What's our current BP at with the 2-liter bolus?
With the 2-liter bolus, your blood pressure is now 82/50.
Ready to intubate.
Sorry. Correction on the esmolol dosage. It's actually, let's do 250 micrograms per kilogram, please. All right. Let's also get some methimazole, Nurse Twinkle, please.
Absolutely.
All right. 20 milligrams PO. If you could ask the pharmacy to crush it so we can give it via an OG tube once we have the intubation set.
Absolutely. I'll
Thank
get
you.
that ordered now.
Intubation's in. Do I have any air in the stomach?
You do not have air in the stomach.
Can I hear it on the left lung?
You can.
Right lung?
It is present.
Thank you.
What do you at the lip?
21 at the lip.
Thank you.
When we're done with that, we'll go ahead and close them.
Hey, Nurse Twinkle, whenever I did the fast exam, did I notice movement with both lungs?
Heather, you need assistance.
Yes,
flipping?
you do have sliding
You need assistance
bilaterally.
rolling?
Any free fluid?
No free fluid.
And how's our IVC look?
Your IVC is good with the fluids.
Anything of note in the cardiac box?
Nothing of note, all normal.
Once the ET tube is secured, do we have an updated pressure?
Updated blood pressure.
Yes, please, after the
Your
ESMO.
blood pressure is 82/56.
You want a bag every 6? Yep.
Are we able to get a portable chest x-ray to confirm too, please?
Absolutely.
Thank you.
Maybe go ahead and get ready to roll. Check the back.
Chest x-ray, doctor.
Thank you.
Bag, I'll grab head.
All right, two placement looks good.
Ready, and 1, 2, 3.
Would you like for me to call respiratory, doctor?
Yeah, since we have
notice any
intubated,
step-offs?
let's see if they can bring a vent down so we can free up that.
And back, 1, 2, 3.
Thank you. Were any step-offs noticed on the
No
back?
step-offs noted.
Lacerations, anything like that?
No lacerations noted.
Thank you.
This is below in the, this is all.
I got for vitals right now.
Your vitals are currently unchanged.
Nurse Twinkle, could we also put an order in for 100 milligrams of hydrocortisone IV, please?
Absolutely.
Thank you.
Orders
And-
into the pharmacy.
Thank you. And let's also start treatment for the sepsis due to abscess. If we can please get,
Okay, vents here and set up, doctors. Ready to take over when you are.
Very much.
Should we give him Tylenol?
Okay, vent is in place.
All right, does anyone need help with anything?
well, right now, Nurse Twinkle, if we could get some additional orders, please, for IV
Yes.
vancomycin.
Absolutely, doctor.
15 milligrams.
I'd like to call your attention to the blood pressure. It is dropping. It is 63/37 currently.
Okay. Let's up the esmolol to 500 micrograms per kilogram, please.
On auscultation
Okay.
are the lungs
You hear breath sounds on the right. They are absent on the left.
on the left. You notice any tracheal deviation?
You do have slight tracheal deviation to the right.
Okay.
Can I get a needle decompression tray set up, please?
Absolutely.
Can we also get the chest tube set up, please?
Absolutely.
Thank you.
And if we confirm that along with ultrasound?
Yes, there is no sliding noted on the left. Needle decompression tray is ready.
I'll swing around for you.
Chest tube is ready.
Nurse Twinkle, in addition to the IV vanc, may I also have some IV cefepime at 2 grams IV, please?
Absolutely.
Thank you.
How much of the milligrams per kilogram for the day?
Put in there or a hat. Is that okay to pretend it's supposed to be?
Yeah.
Thank you.
15. And how much was the other one? Sorry.
Cefepime is 2 milligrams. 2 grams, I'm sorry.
2 grams.
Nurse Twinkle, do I have booties as well?
I apologize, Nurse Twinkle did not hear you.
Booties as well as the hat?
Yes.
Thank you.
Booties are on the
You want me
way.
to go and talk to him?
Yes, please.
Here's the hat. Booties.
I can put my booties on. You're good. All right.
Hey, Garrett. Raise the arm up.
All right, that's time. Big round of applause. Come join me on over here. Oh, is this on? Is my mic on? Is my mic on? Yeah?
I kept speaking, but it was down here.
Is my mic on?
That's fine.
Okay. Okay, can you guys hear me? Yes? Okay, good. All right, good job, everybody. Man, that was a tough case. Tough case. All right. So how did you all assign your roles? How did you decide who did what?
He was the leader last year, so we wanted to kind of continue that trend. I asked to be on chest tube, so I kind of fell into that role. And
I was a scribe for 6 years, so it just felt natural to do that.
Kind of a personal interest in the task itself.
Good. All right. And how do you feel that your teamwork and communication went?
I think these guys did a great job. So they really fulfilled their roles. They were practicing very hard for them. Very proud of this team.
And we had a great team leader.
Definitely a great team leader.
And if there's anything that you had to do differently, looking back, going through, what would you have done? Anything? I'm not saying you needed to do anything different. I'm just asking if you would have.
Addressing the issues quicker from my perspective, for my part personally. I can't see anything that these folks did wrong. They all did a great job.
So a great team leader, right? He's giving his team props, yep. So can you give me an example of something, like something you would have caught earlier?
I believe I was late in asking for the thyroid-specific labs after a suspected thyroid storm in the beginning, given the hysteria and kind of excited behavior. The sepsis would have had to have been identified via the abscess, and I know we asked for cultures early on. I believe I was a little delayed in asking for the lactate level to confirm that.
So I think you guys got right on his physical exam. I was really impressed by that. You got right and were very attentive toward the patient right from the beginning, and started out really strong with the teamwork and communication. And I didn't see a robust differential, but I could tell that you guys were thinking about different things by the actions that you were taking. So whenever you get stuck, just remember, talk it out, right? Think about the differential diagnosis. The only major thing that I'm going to point out medically, I mean, this is a very complex case, very challenging, and there's a lot going on, a lot of medications, and I might have missed it. But when his blood pressure was low, and I think you had just misspoke, and I don't know if any of your other team members heard you, but the blood pressure was pretty low. It was 60s over 30s or 60s over 40s. And I think you said to increase the esmolol. And I think you
correct himself. After he said that, he did correct himself.
He did correct himself. Okay, that was a good catch because we didn't hear that on our end. So, but there was a lot going on, so we had a hard time. So how did he correct it?
He said never mind.
Oh, okay, good. Good catch. All right, so good job. Let's hear from our judges.
Okay, so like Dr. Ziner said, that was an incredibly complex case, and I think you guys did an excellent job. I love the way you constantly rechecked everything and checked in with each other. One thing, I think you did a great job as a leader, but almost too good. Like when you said the incorrect dose of esmolol, everyone just kept doing it. No one stopped and said, hey, let's check in with each other. Then you raised it again. No one said, hey, let's take a break and let's check in with each other. So it almost became a little too mechanical because everyone was so focused on their chores. But otherwise, great. I agree there was really very little history or differential taken. It was like, hey, let's wait till the labs come back. But like medications would have been important in this patient. Like something like neuroleptic malignant syndrome could present exactly the same way and the treatment would have been completely different. So always don't abandon the history and the physical. The last thing too is you have a person with a GCS of 7 that no one talked much about any kind of head imaging or anything along those lines. So that may have been something else, but I think you guys did an incredible job. It was very, very good. This is just little nitpicky stuff, so good job.
Thank you.
Yeah, I mean, just to echo all that, the teamwork between you guys was awesome. What stood out, Heather, you really stood out to me just because you got real deep into going through a physical exam. The physical exam was awesome. You went through exact head to toe. As soon as Michael was like, hey, do a head to toe, you're like, yep, I'm going to do a head to toe. Absolutely. So you did everything, got right in there. Joe, you did awesome as team leader, kind of like Dr. Pepper was saying. But as the teammates, don't be afraid to check in with what's going on, especially when Joe is calling the shots, but like the esmolol thing or that we didn't hear, but anything else, like putting in doing the intubation. Yes, the GCS is 8, but what was the oxygen saturation and what can we do? Not just to intubate as soon as it's 8. Now, I mean, I'm not here to talk about medical stuff, but just checking in with each other even further, especially with the team leader stuff. And you guys stepped in when you needed to, like Garrett and Michael. You guys did great, and alternating roles and switching things and assisting each other. So communication and teamwork was great. You guys did awesome.
Yeah, and I'm not going to belabor it too much, but honestly, I've seen you before in action as a leader. Excellent job doing the examination. All of you cooperated well. Is this thing working? Yeah. Okay, all right. Anyway, but I go back to my background in the military. These people need to every now and again hear a reassuring voice, and sometimes it's forgotten about. And I'm not going to redo everything they said, but that's the one thing that I'd like to point out to you. I don't care what their level of acknowledging anything is. Every now and again when there's a lull, say something that lets them know you're doing things right for them and you're going to get them through it. It really makes a big difference. It certainly did in the things I had to take care of in the military. So, but I really am impressed. Good, and I know most of you. It's good to see you doing well.
All right. So our judges are going to deliberate. And yes, absolutely. And we'll be back with a winner to you shortly. Nice job, everybody. All right. I think the judges have come to a conclusion. So very exciting. Judges, would you like to announce the winner and why?
You do it. All right.
Well, y'all, all 10 of you, 10, did a phenomenal job, and we can tell you put in a ton of work. So one more round of applause for all of our competitors. You guys did amazing. And just the first years, you guys climbed a mountain taller than the second years had to. So you guys put in even more work because this is an extremely complicated case, even like we were talking on the physician level, not only the medical student level. So all of you did amazing. This was a really hard decision for us. You all did so well that, it came down to a few small things that we had to go towards. So if we get a drum roll, please. And our winners are the second year team, the Arctic Puffins. Congratulations. So let's go through a breakdown. First years, you guys both communicated exceptionally well. It was an amazing event. The thing that really stuck out was the second year's physical exam. That was what really pushed it over the edge. Now they went a complete head to toe, super thorough. They rolled the patient. They did so much to put them over the edge on the physical exam. And then it's just smaller things from there, but that was the big kicker. Both communication, exceptional. That physical exam that put it over the edge. But do you guys have anything else? Awesome.